like to ask? Yes. Do you want to introduce yourself as to what stage of training you're at and things so Conor can tailor his answer?
I'm Conor as well. I'm CT1 in the City Hospital.
Okay.
I've been in Australia for 2 years, worked as an unaccredited reg. I was just wondering if you said that a lot of people fail their fellowship exams as international medical graduates. Do you know what the SET training sort of pass or progression rate is?
The progression rate from SET training is actually pretty high. It's about over 80% of SET trainees actually get through the fellowship exam first sitting.
And for international medical graduates to get into SET training?
So getting into SET training, it is possible. It does provide its challenges in the fact that they do insist on a level of experience that is attained within Australia. So they tend to find it more difficult to recognise posts done outside of Australia. So they tend to insist that the jobs which count towards your training in that specialty are done within Australia. The SET training programs are also all very popular at the minute. I mean, even certainly within vascular surgery, we've had a couple of our own trainees recently who haven't got on within the first couple of attempts getting into SET training because the surgical specialties are quite popular. But it is possible to get into it. I know people that have got into it by being committed, but it's much easier to do if you're actually in Australia at the time working rather than trying to apply from outside Australia. So applying from outside Australia without a visa becomes incredibly difficult because the Australian employment legislation means that anybody who has a visa or permanent residence visa or citizenship will automatically trump anybody who doesn't. So if you don't have permanent residence, it's almost impossible.
Conor, Ronan Gray, General Surgery Reg, doing our programme research at the moment. Conor, you had the benefit of going for your out-of-programme training and then at post-CCT level. Is there much of a difference between what the unit would expect? Would they prefer to have somebody post-CCT, or is it sort of that same equivalent? Because the big problem now is the goalposts have changed here slightly, and that you have to be back in the UK for 6 months, do the last 6 months in the UK centre to be revalidated. So I was just wondering, that moves us that we need, if you want to do this out of programme training, you need to immediately be thinking of going ST 7.5.
Yeah, and that is becoming more of an issue with what we've seen in terms of applicants. Essentially, the units in that scenario would generally prefer people to be post-CCT because really for you to get the most benefit out of it as well, you need to be at that senior level where you are starting to function relatively independently, because that's actually whenever you'll gain most from it, rather than still being at a stage of requiring supervision. I was fortunate, and in fact, whenever I went, that was through the course of negotiation with then Jeffrey Campbell, where I'd sort of stated my intentions fairly clearly and to him and Mr. Gilliland, and you know, they knew from the outset what I was planning to do and what I wanted to achieve, so they actually ended up supporting that. But for me, the whole revalidation thing wasn't an issue at that stage, so I can see how that is now becoming a problem. The other thing that you can do is, rather than taking it out of programme training, you can take it as out of programme experience and go at a slightly later stage and just delay your CCT date. That then can have an impact on what jobs are available and things like that. But essentially, the worry about timing of jobs and timing of positions is slightly irrelevant because we don't know anybody who's come back from fellowships and not been able to get a position. If you've come back with that experience, you will get a position somewhere that will fulfill largely what you want to do. And I think the whole concept in the UK at the minute of coming back into the position, and that will be your position for life, is slightly more unrealistic, and there's going to be a larger acceptance that people will move in the future as well.
I think as well, just from the School of Surgery point of view, they are pushing that they get at least 3 months notice, even if it isn't out of programme experience. So you do, you know, just like Conor was saying, you just need to tell them from up front. But I would be, if there was a trainee at sort of ST5 level, I would be saying you need to be thinking about what you're going to do and be very open at, you know, your RCP from very early on, because it does take that length of time for the paperwork to go through, and with the number of regs in Northern Ireland being smaller and this service being stretched, they are really loath to let people go at short notice. So.
Yeah, and it is amazing what concessions you can get just by being upfront and honest and open with them, and genuinely discussing it as part of your ARCP as to what your intentions and plans are, and listening to what they have to say, taking their advice. And you know, sometimes there's a bit of bartering back and forward to do with regards to what you can achieve, but it is important to be upfront and honest and open with them.
Anything else? No. It just remains for me to say thank you very much for coming along. Thanks for your time. And everyone, well, I did, even though I'm not going to Australia, but it was very useful. And you'll be able to access this, and I would point you in the direction of the ASiT website again for this resources, that's for the resources, and for the more junior trainees, core trainees and medical students, the foundation skills for surgery course will be in the new year. Okay, thank you.